Hi, my name is Grace Stum, and my neurodegenerative disease that I chose is chronic traumatic encephalopathy, also known as CTE. So, what is CTE? CTE is a progressive neurodegenerative disease associated with repeated head trauma. So, you most oftentimes see this in former or current athletes or military veterans who spent a lot of time in battle with a lot of explosions or high head trauma, or individuals with high exposure to concussive or subconcussive impacts, so just small or large hits to the head. It primarily affects older adults, but this is also because it comes about later in life, just because it is something that happens kind of over your life period. And this CTE itself leads to severe cognitive decline, mood disorders, impulsivity, and dementia. These are just a few of the symptoms that come from CTE. The pathophysiology is, so basically what's happening in the brain when during CTE is that the neuropathological examination of the brain tissue leads to this certain diagnosis. So you actually can't see that someone you can't conclude and confirm that someone has CTE until death because that you have to see it from the brain scanning. And that has to be like of the brain tissue. And the topathy is characterized by a quote from PubMed is deposition of hypophosphorylated tau or p-tau protein as neurofibrillary tangles, astrocytic tangles, and neurites in striking clusters around small blood vessels of the cortex, typically at the sucal depth. And then also abnormalities in phosphorylated 43kDa TAR DNA binding protein are found in most cases of CTE. And then also the beta amyloid is identified in 43%, which is associated with age. So you can see here in the picture kind of what the brain would look like from a person with CTE that you can find later in life, like I mentioned before, after they've passed. Some of the risk factors of CTE is leading up, like something that can cause CTE is just repeated head trauma. So the most common I would say in researching is contact sports, which is like football, boxing, hockey, rugby, and etc. And this is actually what led me to pick this disease. I had been seeing a lot about it, just especially in football, and it's kind of something that's like being more and more talked about. So that's what led me to the picking this. So then it's just interesting going off of it. And then also experiencing multiple concussions, which is another big thing, and this most likely happens through these contact sports. And then also serving the military, like I had mentioned, motor vehicle accidents, because that's like severe trauma to the head. Domestic violence can be repeated violence and trauma to the head. And then substance abuse issues, because this can lead to kind of you not taking care of your body and or like hitting your head a lot or falling, which leads to concussions or just prolonged brain damage. And then the risk factors once you have CTE are these cognitive issues or symptoms. And I got a lot of these from the Mayo Clinic. And they said that there's trouble thinking, memory loss, problems with planning, organization, and carrying out tasks, impulsive behavior, aggression, mood disorders, and this kind of mental illness, all in that. And then problems with walking and balance. So they struggle with their motor skills as well. So kind of ranges from all areas, both physical but also mental. And then factors about this disease that are uniquely challenging are there's a lack of a definitive diagnosis. Like I had mentioned before, you can't confirm that someone has it until they've passed away. So this makes it difficult for doctors and such to identify this before. So a lot of times it can overlap with other conditions, and people can get CTE symptoms confused with conditions like dementia, PTSD, or Alzheimer's. And then also there's like an unpredictable nature because you're not sure like how much has to cause it before someone officially has it. And then additionally, there's a lack of treatment and ways to manage it. So there's actually no cure or like medicine to help with it. And people are like still unsure of how to manage it. And that's something that's being greatly discussed throughout the world today. The populations who face particular difficulty with CTE, like I had mentioned, are former athletes, once again, military personnel and veterans, survivors of domestic abuse, low income and marginalized communities. This one I researched on, and it said that they experience a lot of it just because they like have less safety precautions sometimes, and they might be living in more unsafe environments. And then also CTE caregivers, this is different from those that actually face it, but their lives are greatly impacted because they're now the ones taking care of these individuals. And then along with it, the family members of those with CTE are impacted from this. And then the discrimination of individuals are the people, one of the questions is, do people who experience this disease or process or its sequelae face difficulty getting treatment as a result of discrimination, isolation, dismissal by the medical community, or aspect of the disease that are taboo or uncomfortable for people to discuss? So one of the first things I found was medical dismissal. So at first people appear physically fine, so then they're not taken seriously because they can't immediately see what the prognosis is. And then there's also lack of awareness because many doctors and those in the medical field aren't very well versed in CTE. That's often very easy to just misdiagnose a person. And then also mental health care is there's a lot of mental issues that stem from this, and it make these patients difficult to work with. So then they're discriminated against because people don't want to work with them. Also, there's a great stigma with CTE because athletes or many individuals are hesitant to seek help due to the stigma around mental health struggles, and this comes from CTE. And then gender discrimination is there's a larger focus on males just because it's in a lot of like male professional sports. And so a lot of times females may not be recognized or addressed in it. And then also, and finally, isolation and relationship struggles because your personality can change so much from this. It can definitely strain a lot of relationships. Some of the unaddressed aspects are some aspects of CT experience that still remain unaddressed by just the medical and therapeutic community is the early detection and prevention, just because it's hard to see from an early point. And then treatment options, like I had mentioned, they still don't have one. And then the other professions at risk, like what is the broader population that could be affected by this or have this? And then also the differences in genders when it comes to CTE, like how it affects each gender. And then treatment options and prognosis. There's no cure or treatment, but there's definitely ways to manage the symptoms. There's medications you can take with pain or different things, and then therapy can help, and then just different lifestyle changes to help live a healthier life. You're having to like adapt to this new thing you may have. And it's like I have mentioned a couple of times, it's a degenerative brain disease, which means that it's progressive, so the symptoms will get worse over time. So it can take years or even decades for it to like get to its full potential. And then there's no way to predict how long it may take to see the decline in the brain function. So there's no way to truly predict that. And then this is my works cited. I use generative AI with the ChatGPT program to help learn more about the disease and provide some basic background information with areas that I was unsure of. So I just wanted to mention that I did use that. But yes, thank you for listening.